Why would someone take an herb called slippery elm bark? Let's find out. Hello and welcome to another edition of the Ask Dr. Pickel show. All right, so today we are going to talk about slippery elm bark. And if you haven't heard of this, hey, keep watching because you'll find out more. If you have, maybe you're already taking it. You may already know some of the benefits. So let's dive right in with this interesting herb. All right, so really what this is it is a bark. It's called the inner bark of the Ulmus rubra tree. And Ulmus rubra, sometimes called the red elm tree. Sometimes people will even call it an Indian elm. I think there's even other names for it too. And slippery elm, which is this Ulmus rubra, this bark, it contains a soluble fiber. And this fiber is called mucilage. Now, mucilage is kind of interesting because mucilage pulls in water and it turns into like a gel, which then that adds like a coating onto things in our body. Kind of interesting stuff here. So it coats our mucous membranes. Now, where are our mucous membranes? We mainly think of like sinuses, but yeah, actually in our mouth, our throat, our lungs, our intestines, our urinary tract. Actually, there's mucous membranes in a lot of different areas. So, and what they think is, hey, this coating that kind of spreads over everything can be soothing, provide relief to these areas, maybe help with the pain and the inflammation, because the stuff is pretty interesting stuff. And also it's kind of interesting because it does contain about 3% tannins. And these tannins, what they do is they help tissues contract. So a lot of people like that benefit because when they use it on their skin, it kind of tightens the skin. Also, when you do that, you even increase kind of a layer of protection. And there's actually some other skin benefits that we will get to with this. Another side note to this was, I think about in 1960, the FDA actually called slippery elm a botanical drug because they were like, hey, this stuff works pretty well. But then in the further questioning, further like, hey, what's the benefits? They were like, well, it's very limited. It's probably not anything. And it's like, wait a second. It's because, again, it's an herb. You can't patent it. You can't sell it the way you would a drug. Sorry to say that. All right. So, oops, there we go. So what are the uses of this? Okay, a lot of people use this for acid reflux, coats the stomach, the esophagus, IBS, irritable bowel syndrome, Crohn's. Crohn's was spelled a little incorrectly there. Maybe we can add an N on there. Crohn's, colitis, really any irritable bowel disease. If you're getting constipation, if you're getting diarrhea a lot, this may be very helpful. And that's kind of what I wrote. Constipation below that. If you're just constipated, maybe without the IBS or the IBD type issues. Also very common, this is used in mouth sores and ulcers. Actually, they even sell this in a lozenge form that people kind of suck on. It coats the mouth. Can be good stuff. And then sore throat, dry cough really wouldn't apply for a wet cough, more of a dry cough. Cystitis. So this would be more like inflammation of the bladder. People who have cystitis. Sometimes it can be caused by an infection. Sometimes it can be caused by an autoimmune condition called interstitial cystitis. But this can coat that bladder, coat the urinary tract areas. And then skin issues. This is what it was used a lot. In fact, this was founded by Indians. Indians said, hey, let's start using this for skin issues, and they would use it for wound healing and help the skin heal up better. But also it's been found to shown some result with eczema, even shingles. When you rub it on these areas, it coats these areas and helps with the healing process. Now, again, there's not a ton of research on this herb. It's interesting that they really haven't looked into it a lot, but it's also known to be a prebiotic and an antioxidant too, which just more benefits. All right. So what do we do with it? How can we maybe use it? When I use it with patients, I tend to combine it with things. I'll combine it with deglycerized licorice. I'll combine it with peppermint or aloe vera extract, and maybe even some other things, because you can kind of put all those things together and get, I feel, even a better benefit. You can buy this in capsule. You can buy it in a powder, salves, lozenges, teas. There's different ways to get this. I would say most labels are around 200 to 800 milligrams per day. If we use these like 800, or some people even go up higher than that, like to 1.5 milligram or 1.5 grams. And but I tend to spread it over the day, maybe like 200 milligrams breakfast, dinner, or breakfast, lunch, and dinner. I would say the majority of people have no problems with this. Every once in a while, I'll encounter somebody who is sensitive. Usually those people have an autoimmune issue, chronic health issue. Their immune system is already having trouble with a lot of other things. But there really is no known toxicity with this herb. Pretty neat stuff. So slippery elm, maybe something to try if you have any of these issues, and it could have multiple benefits for you. So hopefully everybody enjoyed today with slippery elm bark, and have a wonderful day. God bless, and I will see you next time.